Well, very good morning. Thanks for joining us here on Healthy Living South Mississippi. We're joined by Dr. Reagan again with Retina Specialist of Mississippi. How are you?
I'm doing very well. Thank you.
Absolutely. Thanks for joining us. So we're going to talk today about a subject that is very common in maybe not necessarily South Mississippi, in the South in general. It's in diabetes. And so while that maybe isn't a subject that maybe you're a complete expert on, the the problems that occur with the eye because of diabetes are. So tell us a little bit about some of the issues that maybe some of our viewers may be experiencing with their eye health just strictly because of diabetes.
So diabetes, among many other health conditions, one of the big complications that can happen is related to the eyes and the vision. It can range from something as simple as blurry vision to other symptoms like floaters or visual distortion or missing vision. And so many parts of the eye are affected by diabetes, and I see a lot of patients with diabetes in this community.
Now, when you say missing vision, does that just mean that spots of your vision you don't see anything?
It can mean spots that you don't see anything. It can mean total loss of your vision.
Oh, wow. So I guess it's a challenge here for a multitude of reasons, but there's a large population in Mississippi that have diabetes and have no idea.
That's correct. About 15% of the people in the state of Mississippi have diabetes, so 350,000 people in this state. And it's estimated that about 75,000 of those people don't even know they have it. So a population the size of Gulfport living out there in the state doesn't even know that they could have this condition.
And again, it goes without saying how important it is to have health screenings as often as necessary, because in situations like this, healthcare costs can skyrocket in just a very short period of time when you have something like diabetes.
That's correct. On average, people spend 2 times the amount on their health care than someone without diabetes. And certainly as your diabetes is uncontrolled or getting worse, the healthcare costs can stack up. So it highlights the early detection and early management of this condition.
What are some of those things that doctors are looking for when they find that someone is diabetic? What's some of those I guess those triggers that you're seeing?
Sure. So blurry vision can happen just from fluctuating blood sugars, and changes in one's prescription or their refractive error can be a component. Diabetes can also cause early cataract progression, and cataracts are something that can affect the vision. Patients are known to have a higher chance of having something called glaucoma, and that's something that can be monitored for as well and diagnosed. The big problem with diabetes that can cause irreversible, permanent vision loss is diabetic retinopathy, which is one of the parts of the eye that I'm a specialist of and that I treat regularly.
What percentage of those patients are going to be looking at something like diabetic retinopathy?
So about 25% of patients with diabetes, so a quarter of patients, can have some degree of diabetic retinopathy. And of course, there is stages of severity, and so not everyone at every stage needs some type of treatment. But a small but significant portion of diabetic patients, upwards of 5%, can have vision-threatening disease. And that vision threat can either be something temporary, but it can also be permanent vision loss as well.
And we're not talking about something that will be onset in 20, 30 years. It's a much shorter amount of time.
It can take in as little as a few years, so 5 to 10 years, to develop diabetic retinopathy that can cause your vision to get worse.
Are there those individuals in our community that are maybe at a higher risk for it?
So while anyone can get diabetes, any ethnicity or socioeconomic background, we do see higher prevalence in the Black community and the Hispanic population as well.
So what do you do for those patients naturally you have diagnosed patients with diabetes because they came in and had an eye exam that didn't know they had diabetes because it was such a severe case in their eyes?
You can diagnose someone with diabetes almost just looking in their eyes one time. So certainly if patients are diagnosed with diabetes, they are recommended to get an eye exam and then repeat an eye exam annually. If you're at high risk of getting diabetes or other health conditions or a family history, certainly eye exams can help with early detection of some of those problems that may go along with it.
I love that you said early detection. That's key. What are some of the things that you can do to manage something like diabetic eye retinopathy if someone comes in and hasn't, just didn't know, but they're early enough?
Sure. 90% of diabetic eye disease problems can be treated or prevented, and people can keep their vision forever if it's detected early and possibly treated. some things, just like a good management of the disease and controlling blood sugars as well as blood pressure and some of those other things, can certainly help stave off more severe disease. And, managing some of your lifestyle choices and lifestyle modifications go along with that as well.
Well, see, there you go. You're making us have the hard conversation about, having less of the delicious things and maybe more of the healthy things. If someone is diagnosed, what are some of the treatments that are available that you offer, that you administer here in your office or even in a hospital setting? And do they come with like difficult, uncomfortable sensations or pain, things like that?
Sure. So managing diabetic eye disease can be simple as just observation, whether it's frequent observation, intensive monitoring for big changes, or it can range from something like an eye injection or a shot of medicine in the eye or laser treatment. More severe disease is sometimes recommended, or surgery may be necessary for that. A lot of patients may be apprehensive or afraid to come in, to think they may need to get an eye injection, but we do take all the considerations for that, and I try to make all those procedures as comfortable and tolerable as possible.
I think that's key, because I would say, and I don't know, I'm going to just guess and take a stab in the dark here. I would say the alternative is significantly worse than coming in and having a few moments of discomfort.
Right, and that's something I try to express to patients. I don't want you to, miss out on vision-saving therapy and keeping your vision for, some type of anxiety about what you may or may not need. You don't know until you come and have an eye doctor or an eye care provider check your eyes and see what's going on. And if some type of treatment may be warranted, that's why I'm here.
I know it's apples and oranges, but we will just plop down into a dentist chair, knowing that it's not going to be comfortable to fix a tooth that can be pulled out and replaced with one that is not real and still function just the same. Can't take out an eye and replace it with something that's not real and have the same level of function.
That's correct. You only have two eyes and you need to take care of them. And while I have not had an eye injection personally, I give thousands of them. And so I want to make sure that patients are able to get the treatment they need and feel that we're providing the right comfort and care in order to get the treatment that you need.
Well, and you have some patients that have no discomfort at all.
That's true. Some patients don't feel eye injections at all, and some may feel a little bit of pressure or a little sting or something. You talked about the dentist. I've had many of those injections, and I know it's nowhere like that. It's very brief, and patients do quite well with them.
So listen, if you're having some blurry vision, if you're having some floaters, if there's the missing vision at all in spots or in your entire eye, you see that phone number at the bottom of your screen, you see the website, give Dr. Reagan and his team here a call. They are here to help you. They're here to make sure that you have the eye health that you need to last the rest of your life. Dr. Reagan, thanks so much.
Thank you.